Welcome to the Mental Insights Podcast. This is your host, Brendan.cutuli, and we are here today with Ruschelle Khanna. She is a licensed clinical social worker who is based in New York. And Ruschelle has a great story alongside a lot of practical and insightful tips and approaches to how she works within the mental health field. She's going to dive a little bit more into the effects of Lyme disease and how that can have an impact within your own mental health, and why we need to start approaching the conversation of how a disease can be so impactful to our own mental health and why it's spreading so effectively today. So Ruschelle is going to offer a lot of insight within this topic specifically, and we're going to speak more about her practice as well in New York. So Ruschelle, if you just want to offer this time to share a little bit more about, what you like to do elsewhere and really what you're up to today within your work and just your hobbies in general today.
Okay, great. Thank you so much for having me today. I'm super always excited to talk about mental health and the overlap between that and physical health. So you asked what I enjoy outside of working. I work a lot and I love to work. So I was like, oh, what do I like to do anymore? I love to travel and dance and be with my dog and my husband. And when I'm not working, I'm thinking about working because that's what I love to do. So
that's awesome. That's you find a very, very few select people that do enjoy that, but it's very refreshing to know, because on the flip side, you need to be passionate about your work, and that's what's so great to hear, because you constantly have this itch to show your passion and continue the work that you're doing today. So that's so awesome to hear. I hope I can say that soon. I'm actually graduating in like 3 or 4 months, so hopefully I'm in the same boat as I start my work career in an industry rather than education. So that's exciting.
Awesome. Well, congratulations for your upcoming achievement.
Thank you. I appreciate that. It's definitely something to look forward to for sure. And really, I think, when I heard your story, when I started speaking with you, I was not only blown away, but I was I was very speechless in terms of, first of all, how you were treated, but as well, the effects that you were able to see, overcome, and where you brought yourself today. I think it's truly a story that I'm going to be so happy to share with others. And why don't you explain a little bit more about how Lyme disease came into your life and what role it's played within first your physical health, but then we can lead into the discussion of mental health.
Sure. So I guess the first thing before I tell my story is that I believe that Lyme came into my life. Sorry, my dog is barking. I believe that Lyme, he never barks like this. Thor. Sorry. So Lyme came into my life, and it was really a blessing. And it was really the best thing that ever happened to me outside of my getting married. Lyme to me is a psycho-spiritual experience. It is not that for everyone, and I don't put that on people when I see them. But for some people, going through something like Lyme, like cancer, but there are a lot of differences between Lyme and cancer, can radically change your life for the better. So that said, my experience with Lyme was that I was kind of low-grade chronically ill for years. Had a lot of anxiety through grad school, had a lot of mood swings, was drinking too much from early college, but never really sick, just kind of chronically not feeling well. mainly mental health stuff. But then March 3rd of 2014, I'd been in Thailand, and I'd spent several years in India leading up to March 3rd of 2014. My dad was dying of cancer. I was overworked at my job. And I went to the gym that morning because I was lifting a lot of weights. I was working out a lot. I thought that I felt pretty good, but I had some insomnia since I'd been in Thailand, so for about 3 months. So I go to the gym that morning, and I nailed the heaviest back squat. It was like a PR on my back squat, and my neck started hurting. I was like, oh, that's weird. I don't usually have neck pain, especially from a back squat, whatever. So I get home, and as soon as I got home, I fell into 9 days of seizures that did just continuous convulsions and seizures. I was in and out of the emergency room. I lost my vision for a time. I lost my vision and my hearing. I was hallucinating. Basically, was dying. Felt like I was dying. So for 9 days, I wasn't sleeping. They couldn't figure out what was wrong with me. Somehow I found a physician, a practitioner, and this is all without medications, but I found a practitioner who was also an osteopath and a psychotherapist. She's pretty amazing. And being a mental health clinician, I thought to myself, I either have to get to sleep or I'm going to have to check myself into a psychiatric hospital. So I found this clinician, and she did an osteopathic adjustment on me. She spoke to me about my experience, my hallucinations, and gave me some supplements. And I went home and slept that night. So I didn't have to go into a psychiatric hospital. And from there, it sent me down this rabbit hole of what the heck is wrong with me. I kept putting my symptoms in Google over and over again. It kept coming back that I had mercury toxicity. I did have 4 mercury fillings at the time. So I had my mercury fillings removed, which is a whole other story. I know that's very controversial. I know a lot of people don't believe that's even a thing. I get that. This is just my experience. I was in a mercury Facebook group, mercury toxicity Facebook group. I kept putting my symptoms in. I said, I've had my teeth removed. I'm still sick. And they were like, you have Lyme. And I was like, well, what's that? So I didn't even know what Lyme disease was. And that's pretty shocking because Lyme disease is the fastest growing infectious disease in the country. More than 300,000 people per year minimum are impacted by Lyme disease. So the fact that I didn't know what this was just disgusting because I worked in I was running health and mental health clinics. I knew what AIDS was, but I didn't know that this thing bigger than AIDS was happening. So I looked into Lyme. I found a Lyme doctor and a host of other things that I had to do. But I started getting better. And I also decided that I wasn't going to be sick. I was either going to die or I wasn't going to be sick. So, yeah. So that's kind of the acute part of my story. And then there's lots of stuff that happened after that. And it's why I am doing what I am doing today. So.
That's awesome. Thank you for sharing that. I think it's important to know, the process and the steps that you went through to then find out truly what was best for you. I think that's a good relationship within a lot of people of how they seek out help is, at least within the mental health field, there's a lot of different pathways that you can take in terms of finding out what's best for you and how to overcome, whatever illness or disorder you're facing with, some people don't necessarily know that pathway. They don't know what's the best way for them to seek help. And I think that's important that you showed, you took the steps diligently to try to find what was best for you. And I love that how you left off, your perspective was, I'm either going to change or I'm going to die. Like there's that defining line that I'm going to take control of my illness and take control of what I'm facing because I have to get better and I want to get better. I think that's an important, that's a big change within the perspective of someone really wanting the help versus only knowing that there is an issue that they need to overcome and face. So I'm so happy that you brought that perspective up because it's definitely very important to change the way that you see yourself, your illness as you're going through this, because at the start, a lot of people, it's a negative perception of what they're going through and how they can get out of it, if they even think that they can get out of what they're facing. If you have anything to share, please do.
Yeah, I mean, I was definitely terrified. And I think though there was a shift, I didn't really understand how much of a victim mentality I had until this happened. And I don't really know what it was that what changed in me to say I'm not gonna let things control my experience. And I think when we're really sick, that's very hard to do. But I would encourage people to find resources to try to, if you don't know what a victim mentality is, or you feel like, the world always takes advantage of you, that sort of thing, how to find somebody to help you get out of that.
Definitely. I completely agree. Those interpersonal connections and relationships are so important. That's why I think any type of therapy or interaction, obviously finding the right one that's best for you in terms of how you can interact with another person comfortably. But once you reach that step, it can be of such value in terms of, the give and take out of the relationship and learning more about yourself and learning more about, what next steps are. I think for Lyme disease, not many people, I think some people are aware of it, but when I was reading the statistics after we spoke, hearing those numbers, I had absolutely no clue that it was as impactful to the country as it is. For 300,000 people to be affected by this disease, I didn't think, twice originally when I have heard of the disease, years ago. And I think that's why I think the conversation needs to continue. And there's a lot of different aspects in terms of what are the effects. And I think a lot of people will strictly go towards the physical effects, but there still are the mental effects of you being affected by this disease. Could you share more about not only the physical effects that you started to notice, one being your neck, but then how did that transition more in terms of your mental health as you were going throughout this journey?
Sure. So just a little bit of background about Lyme. Lyme is, so when we in the Lyme community say Lyme disease, we actually don't just mean one specific disease. So Lyme disease specifically is a bacterial infection, meaning it's a blood infection. It's a systemic infection. It's a cousin to syphilis. So it lives in the blood and bodily organs. Essentially, it goes to your weakest points. So it also likes fatty areas because it's a bacteria and they love fatty places. So the brain, the heart, the kidney. But when we say Lyme, we actually mean Lyme and co-infections. So co-infections are also spread through ticks, and there are a myriad of other tick-borne infections that can be present. And sometimes Lyme, the bacteria, may not even be there. It may actually be a co-infection. For example, a common one is Bartonella. That is kind of commonly known as cat scratch fever. That Bartonella is a parasite, a very small microscopic parasite that can cause a lot of mental health symptoms: rage, agitation, suicidal, homicidal ideation, things like that. So Lyme is kind of a wraparound and a catch-all for all these infections. Physically, if someone traditionally has Lyme disease, they may see a rash. It is a ring, a bullseye rash, but the majority of people that report Lyme don't get a rash. I didn't have a rash. Neck pain, knee swelling, facial palsy, so a sagging face, Bell's palsy, fatigue, fever-like symptoms, and brain fog. A lot of people classically get fatigue. That was not something that I had. So again, everybody is different.
Definitely. I appreciate that. I think that was a great insight to more of what you can understand in terms of, if you're starting to, be affected by this disease. That's why I think, specifically Lyme disease, that's, covering all of these wide variety of, bacteria infected diseases. They're not all of these effects necessarily you can't pick up right off the spot. So for some people, it does take longer to understand the effects and understand that they're being actually harmed by this disease. I think, for someone that has gone through it, what was the defining moment of you wanting to say, all right, something is not normal? How do I seek help? Because for some people, at least, if you experience some fatigue or some of these symptoms, a lot of people may put that off, which a lot of people do within mental health as well, of just saying, oh no, that might just be today. That might just be a weak spell within, my life. For yourself, what was the defining moment of saying, all right, I need to take a step forward for resources? And what was kind of that mindset change as you went through that?
So yeah, a lot of people, in a way, I was lucky because I had an acute incident with the seizures and losing my vision and hearing. And I literally thought that I was dying. And a lot of people with Lyme have some sort of a pivotal moment where physically they feel like they are dying. Some of them don't, though. So if you don't, the most important thing to do is to talk to someone about a baseline, meaning, if you're not sleeping well and you've had fatigue for 3 months and you've had neck pain and pains that kind of come and go, or ongoing digestive problems, or mental health symptoms, brain fog, derealization or depersonalization, when is enough enough? And you have to decide for yourself that you deserve better in your life, and this is an area that you need to put some effort in. So you're right, a lot of people can live with chronic knee pain and chronic fatigue and just kind of push through their day, but to those people I would say, you don't have to, and there's always a way to feel a little bit better.
That's a great answer. It's definitely so important that people seek out the help when they need it. I think a lot of people, specifically within mental health, even young adults, they experience these negative thought patterns, these challenges, these traumatic experiences within their life, and they think it's just all a part of the process, and they don't seek it out. So that's why I think it's so important that people will reach out when they do, and we need to have resources for youth, for people of all ages to want to seek out help, no matter if it's a few symptoms of any mental disorder, or if they have a wide spectrum that they really need this in or out of care whenever it's necessary. I think we're severely lacking in terms of having resources out for people today. I think yeah, go ahead.
So on that note, I want to give 2 resources that someone can access and then follow up with a mental health provider. If at all you think, something's not right. So if you think maybe you're depressed, but you're not sure, you can look up the PHQ-9. So the PHQ-9 is a measurement tool that we use to measure depression. It's just a questionnaire. You can fill out the questionnaire and then take it to your mental health provider or your primary care physician. If you have anxiety or you're worried about anxiety, you can use the GAD-7. So the PHQ-9 and the GAD-7, you can look them up online. That's what we use in my office when people come to meet with me initially. You can take it. If you feel like it's not going to trigger you, don't look at anything online that's going to trigger you. Wait and look at it with somebody, and then follow up if it looks like, ooh, I'm answering yes to a lot of these.
Wonderful. And we'll make sure to provide those links to any of them within the show notes. So we'll make sure that people who are listening can get in touch with those resources so you guys can at least get a preliminary review of what you're going through right now and if you need to seek out further resources. So thank you for providing that. I think that is definitely a good first step to seeing what you could look for further with what you're facing today, because there are a lot of youth that do not want to seek out that help, but maybe those tests and those questionnaires will allow them to uncover a little bit more about what they need to move further in terms of getting their mental health on track. I think you spoke a little bit about it, but the differentiation between physical health and mental health, how these misconceptions, how society looks at it today. Can you share more insight about why we need to be aware of both our physical health and our mental health, how they're connected, and what are some forward progress that we could make within these fields, and talking about that they are connected rather than if you break your leg you have to get fixed right away, where if you have a mental illness, you have some resources, you can talk through it or take medication, but it's not necessarily going to be right there away. So could you share a little bit more about the contrasts and similarities between the two?
Yeah. So in terms of our physical and our mental health, a lot of times I like to speak in extremes because I work with a lot of people who are suicidal. So I think suicide is a good example of, the ultimate care of ourselves when we think about the act of suicide is not, we don't have the resources to take care of ourselves physically. It's easy to think about the connection between, okay, I need to eat well, or okay, I need to exercise. And these are all things that are good for me and good for my mental health. But when we think about suicide, that's the ultimate, I don't have mental health resources. And that's what the consequence of that is that, you're no longer with us. So there was a great article today, I don't remember where it was, but I'm sure if you Google it, you can find it, about changing the language around suicide. The article was about stop saying they committed suicide. So no one would say they committed a heart attack. Like this isn't something that you're blaming or that you're even necessarily deciding to do. And a lot of times suicide can happen because of inflammation in the brain. We know that traumatic brain injury and things like chronic infections increase our risk of suicide because life is painful. So changing the language, I loved that article. I thought it was super smart. Stop saying that people commit things when it relates to our psyche, because the brain is a muscle and it's connected to the rest of the body and it can be injured. You asked another question. I can't remember what the other question was. Sorry, I got carried away on that one.
No worries. No, I think that was great. And yeah, I think the other part that I was trying to speak about is, I think the misconception that society plays within it of, fixing your physical health versus fixing your mental health, how that's kind of, it's not necessarily looked at as the right way. We'll always go and fix a broken leg first rather than fixing, someone who faces bipolar disorder.
Yeah, well, the thing of it is that all the ability to do all of those things, so the motivation to go to the gym, the motivation to eat well, the motivation to make more money so that you can have a better quality of life, all of those things come out of a therapy session. Our mindset, it doesn't have to be therapy. It can be your religious community, it can be a coach. Therapy is good because it helps us process trauma and look back and do better. But any of those physical things that you want to take action on, they start with your mindset.
Awesome. Yeah, I think mindset is so important. And to touch back on a little bit on what you're speaking about in terms of the comparison to suicide, first of all, I think that article is so great. And I'm hopefully going to find that so I can provide that within the notes, because I've been speaking with someone from overseas in the UK who his father passed away due to suicide, and he's trying to change the conversation about it, because I think the intention is, there's a fine line between how you're wording this and how you're saying someone resulted to this action. And I think that's also why the misconception about mental health is, it's so drastic today. There's such a big stigma and a different approach to how we're speaking about this topic. And I think that's because there's two sides of it. There's, when someone experiences a mental health issue throughout their life, whether it's their lifestyle, so whether, they're experiencing depressive episodes or anxious and stress levels are rising throughout their life due to their lifestyle and what they're providing around themselves. But there's also people who have the chemical imbalance of a true mental illness, where someone really has no further opportunity and judgment to correct it right away, where they have to go through a lot of different psychotherapies and going through different medications that they need to try for it. They need to be in inpatient care. And I think that's why I think there is a big stigma around it, is because, we're not talking about it in the right ways. We're not sharing both sides of the story. We're able to talk about someone who's experiencing a depressive week within, being stressed at work, and maybe their relationships aren't going well, or they're leading to, any type of alcohol or substance abuse. But there's also people that, could even be living a perfectly healthy lifestyle, but due to the chemical imbalance, due to them having schizophrenia, they need to be in inpatient care. And I think that there's a big kind of just cloudy area between how people are talking about both instances. So I think that's why it's important, like you were saying about saying committing suicide, a lot of people, it's not their intention. Their intention is to suppress the pain. And that's why obviously some people do lead to the substance abuse, but this person resulted in ending their life. And, speaking about that intention is so important, and trying to clarify it is very, very important in terms of just how you're creating this conversation. So if you have someone that you lost due to suicide or so forth, you want to create a message in terms of, changing the future, not making it a pliable option for someone who is depressed or experiencing bipolar disorder or another illness, that they say, oh, that's another good option. So I'm so happy that you brought that up. This also brings into, speaking more about what you offer as a clinical social worker and your work within what you're doing in New York. Why don't you speak more about your company and what kind of therapies you offer, you specifically, as well as your team altogether.
Sure. So I own a new therapy group, and I have 3 clinicians who are just fantastic. So our overarching mission is that we work with people who maybe consider themselves perfectionist, type A, overachievers, and that's our specialty. And actually, all of those things are not like a diagnosable problem. We consider them really special and a special type of person. So we consider them your strengths. It's just that sometimes our strengths we go beyond our strengths and start doing things that are not helpful to us, and that's everyone. If we take our strengths too far, they can lead us down a bad path sometimes. So in that group, we work with people with chronic illness. So obviously, Lyme disease, about 40% of my practice focuses on individuals with Lyme. We have a veteran he's actually active reserve. He's still in the military. So he works with our kind of perfectionist, want to do it all emerging adults. Then we have another clinician who works with women who have abandonment and attachment, trauma, and then we have a men's mental health specialist as well. And then I work with executives and entrepreneurs. I do not only the chronic illness work, trauma work, but coaching. I do in-home sessions. So if families need me to come and help develop a team for them for their health and mental health needs. So I do that as well. I'm a social worker. Social workers typically are maybe, I don't know, I like to think we're like a little scrappier, and that we don't care to do things like go into people's homes and things like that. So a lot of our sessions actually focus on stuff that's happening outside of the session. So there's a lot of homework. We're pretty highly engaged. And that's different from something like traditional psychoanalysis, where there's a lot of really deep listening, which we do deep listening, but we also like to take action as well. So we really enjoy what we do, and I just would love to hear from anybody that wants to learn more.
That's awesome. And we'll make sure to have the website to your group and all of your contacts within the show notes so people can get in touch with you, whether it's to speak more about your story, their story, or if they want to come and gain a resource from your group, because I definitely think you guys offer work within a wide variety of spectrums. So you could fit into many people's opportunity that they want to seek out a social worker and hear more about the work that you guys do, because it's so important. I think the action part of your mission is very impactful. I think action is what you should lead to rather than message. I was just speaking about a friend with this is the difference between message and action, the difference between when you're going through, whether it's a mental condition or a physical health condition, speaking and sharing, whether it's new insights that or insights that you should be following through with, is a big difference than actually following through with it. I think following through with action really teaches the biggest moment. It teaches the biggest lesson. And that's why I love that you guys offer that homework. I think that's very important to be reflective in that sense. I actually just interviewed a woman named Christy Horner, who she has a nonprofit organization to help caregivers. So caregivers who are helping those through mental illnesses. So what she provides is homework as well, week to week. And I think that model should be implemented more and more throughout, different types of social work, therapy sessions, so forth, because action is where we really gain that growth. You can talk about any type of, the first step is obviously talking about through whatever negative or traumatic experience you go through, but then following through with action to create that discourse between a negative and a positive in terms of being unhealthy and healthy is the next step. So I'm so glad that you guys promote that within your work. I think that's very valuable for not only your clients, but just to see for themselves of how they are getting better each week and, what they did wrong, what they could do better. I think CBT has been a big practice that's been, gaining a lot of steam throughout all, therapists throughout the country of what I've been able to see and speak with. Can you share more about cognitive behavioral therapy and what are some benefits to that practice that you've noticed thus far?
Sure. So cognitive behavioral therapy is very simply looking at your thoughts, your feelings, your actions, and your body sensations. I kind of describe it as a more brain-oriented or like logic-oriented entry to therapy. So there's a lot of writing, there's a lot of slowing down and really identifying the thoughts and identifying the feelings. I consider it kind of a first line of defense for coming into therapy. So it's a skills-based therapeutic model. Once you learn the skills of cognitive behavioral therapy, you have them forever. They work off of principles of irrational thoughts, but I say that in quotes because I don't like to call them irrational thoughts. I think thoughts always have a place and a time. It's just, are you using them in the right place and the right time? But they help you identify, wait, is this, am I judging this correctly right now? Is my thinking lining up with what's happening? And it has such a wide range of therapeutic spaces, anything from insomnia to trauma to anxiety. It's just, everyone should know CBT.
That's awesome. Yeah, I think there's a lot of different outlets that people are beginning to use within therapy, and the main premise behind CBT that I've begun to understand is that emotional intelligence and self-awareness aspect of it. So it's starting to learn more about, who you are, what you do within certain environments, within how your emotions and thoughts play into it. And that is one of the most valuable skills that I've been focusing on alongside gratitude, because those are ones that really change your perspective of not only yourself, but of your life, of how you're going throughout your day. So it offers a lot of great insight into, next steps that you could be making within your life and some steps that you were making in your past that necessarily were good, but you could improve or you could change from. I think it's a very reflective approach to, the way that you interact with not only yourself, but your relationships around you. One thing that I really loved about researching more about you is this question that I think you'll truly enjoy is, why is therapy a collaboration? Why does the patient have to give just as much effort as the therapist, the social worker? How does that play? And we spoke a little bit about how important the interpersonal connection is, but could you share more about why therapy should be a collaboration more than just a speech or a listening session?
Yeah, so I will clarify that though. Therapy doesn't, if someone is saying, oh, I don't really have any more energy to give, I just want to come to a place and be taken care of. There is collaboration in that as well. So a really good therapist should be able to meet you wherever you are. Things like, if you're like, look, I'm in a crisis, or I'm too overwhelmed to do work, then things like deep listening, hypnosis, things that are a little bit more passive processes are a great place to start. So the collaboration really comes from showing up and being honest and finding someone that you really like and that you really trust. I have had clients that said, I went to this person for therapy for 10 years and I didn't really get much. And I didn't even really like them very much. So that's fine if that's what they could get, is what they could do in the moment. But really looking for a therapist that you connect with, because the number one indicator about how well a person is going to do in therapy is the relationship between them and the therapist. It doesn't matter what modality the person uses, so says research. The relationship is the most important thing.
Wonderful. That's definitely very important to speak about, because a lot of people that I've been in contact with have really experienced a lot of hardships in terms of finding the right therapist, finding out what's best for them and what treatment is going to give them the most benefits in terms of changing their lifestyle and changing the way that they want to approach their own mental health. Is there any insights that you could give the audience in terms of, if someone is struggling right now and they say, I need a resource right away, and whether that be speaking with someone, so going to see a social worker or a therapist, what is your best approach to trying to find the right therapist for themselves? Because there is a lot of backlash in terms of, which one's going to be the best therapy for you and which one's going to provide, the most interpersonal relationship. Because obviously some people do go and they don't want to seek out the action process. They want to speak through their problems, but there's also some people that want a more interactive approach. What are some keys and insights into finding the right therapist? Obviously, everyone's a different person. Everyone has different actions and thought processes. But as a whole, is there any go-to resource, or is it, more do research on your own? What would be your best approach to someone that needs to find a person to speak with as soon as they can?
Yeah. So if you have no idea like what type of therapy a person does and you're like, I don't know, I just need to talk to someone, then a lot of therapists now offer a 15-minute complimentary consultation on the phone. If they won't do that, that's probably not someone that I would go to. I definitely wouldn't go to someone who won't talk to me for 15 minutes, because it is a relationship and you can learn a lot about a person in 15 minutes. So if you do have some idea of why you want to be in therapy, write those things down, have like 3 key points, and look on, there's some great sites depending on where you are in the country. You can look on sort of algorithm sites like ZocDoc, ZenCare, if you're local, My Wellbeing. Find your local mental health search startup, and they're doing a better job than Psychology Today is still a decent resource, but there are some that are newer and better. So find those, pick some people that you like, and get on the phone with them. If you need to see someone right away, then drop into your urgent care and tell them that I need a recommendation, or I need to talk to the psychiatric provider on site. So just go get help. If you have time to kind of think through it, then get on the phone with them.
That's awesome. That's such a great opportunity for others to get on that 15-minute phone call. I love that you offered that perspective, because if a therapist, social worker is not going to offer their time for 15 minutes for a client, then I definitely agree. It should be someone else. That's such an important value for a social worker, a therapist to offer for those who need that quick call right away, because that call could change their approach to, seeking out resources and seeking out therapy in a positive light. So thank you for sharing that. And I want to offer this time, before I ask my last question, I have really, I like to offer this opportunity for my guests to share any tip or lesson or story that they would find to be insightful for my audience. It can be anything on the spectrum of mental health or your personal experiences. So share something that the audience would gain some insight or some value within, something that doesn't necessarily have to be what we spoke about today.
Sure. So really the first thing that's coming to my mind is I recently spoke at a large company regarding mental health, and because it was Mental Health Awareness Month. And someone asked a question about, in this company, they have like CPR on someone who knows CPR, and someone trained to handle medical emergencies. It's like a peer. It's not someone that's paid to do that. And the person asked, gee, I don't know how to handle a mental health crisis. Like, where do I go to get trained to handle a mental health crisis? So there are some places where you and your company can be trained, or your family. I think every family should make it a part of their plan to have someone who, if you're not a mental health professional, can handle a mental health crisis. We're planning to offer this year, it's called QPR. So we teach companies to have a peer on site that is qualified to do QPR, which is mental health CPR. And I can provide a link for that website as well. There's also mental health first aid is another great one that is kind of gaining steam. A lot of schools are using that as well. So take the time to learn your basics about how to handle a mental health crisis, because you never know when someone in your family might need it, when you might need it, or someone in your community.
That's so valuable. Thank you, Ruschelle, for sharing that. That's definitely going to be a big priority within the very near future. I think everybody really needs to understand what mental health is and understand how to approach it in a crisis situation, such as that. It's something that I think not enough families, not enough work environments, not enough young adults today are aware of. And I am definitely excited to continue this conversation and really try to develop more of a awareness for why resources need to be a number one priority within our health. It seems like mental health is still in the back burner. It's still not being a top priority within healthcare and healthcare professionals today, which I definitely think is what we need to continue to focus on and continue to shed light upon, because mental health has some severe effects, and it's really losing a lot of our loved ones throughout the world today. And it's very sad to see, but hopefully we can continue moving in the positive direction and continue to bring resources such as yourself, such as this conversation, such as building up some more resources within our local areas for people to understand more about what they're experiencing and some forward steps that they can make within their own life. I just want to thank you for being on here today. It really was a pleasure. And the last question that I like to ask my guests, it's kind of a reflective question throughout their past year or so. So what I like to ask my guests is, imagine that throughout your life up to this point, you're going to have a book and you're going to have chapters written about different time frames, timelines of your life, of what you've been able to accomplish, of lessons that you've learned. And I want to ask you, throughout this past year, so throughout 2019, you can even creep into 2018, of what were some, lessons? What was a profound lesson? What was a profound experience that you had throughout this year or two? And why was that going to be a chapter within your book? So why was that so impactful? Why did that bring such a value to your own life and to the way that you're going to continue moving forward within your life?
Yeah, so the chapter would be called Commit Fully. I got better. I got better from Lyme, and there were times when I didn't know that I would physically be better, even though I felt like I was kind of spiritually healed. I got better, and then these past few years have been me just kind of not committing fully to my health because I have it again. So starting to take it for granted. I've been doing a lot of self-help stuff myself, and this idea of committing fully that would be the chapter of this year. Is that when I go back to committing fully to my own health and to my own greatness and my own really striving to be the best person I can be, I am the happiest. That's why I got Lyme in the first place from a spiritual perspective, was to focus me on my life and the value of my life. So I guess that chapter would be Commit Fully.
Thank you so much, Ruschelle. I love that answer. I think that speaks volumes about the way that you approach sharing your own story, the way that you approach how you go about your work, how you're continuing this conversation and continuing offering resources to those who may be struggling, may be facing a difficult challenge or an obstacle, or facing a traumatic experience in their past. I think it's very valuable in terms of who you are and where you've come today. That's awesome that you were able to see a spiritual connection and a spiritual growth throughout such a time that can cause a lot of pain and inflict a lot of different types of emotions and experiences throughout someone's life. I think you took what you were faced with head on, and you created such a beautiful array of yourself, your work, and what you're going to continue to do in the future. I'm so grateful that I was able to share a tad bit, a little insight into who you are. I really look forward to continuing our connection. I think there's still a lot more to share within Lyme disease. There's still a lot more to speak about in terms of its effects on mental health, in terms upon how we can continue to treat it and offer resources for people. And I think we're definitely going to continue to speak about different ways of how we can share our own experiences, share our own thoughts, emotions that we go through our own mental health journey. And there's definitely an exciting future within trying to combat such a large crisis within the mental health field. I'm so thankful that we were able to be connected. I really appreciated you being here in this conversation. It was so wonderful to speak with you. I really enjoyed this conversation and learning more about yourself. I hope we can continue this connection and really move forward in a positive light within mental health. So thank you again, Ruschelle. It was really such a pleasure to speak with you.
Awesome. Thank you so much for having me.
Of course. It was such an honor. I'm so glad that we were able to speak and share